Hello, my name is Dr. Richard Bain and I am the Programme Lead for Cardiac Physiology here in Southampton. I would like to talk you through a short presentation introducing you to my world. So what is cardiac physiology? Well, it involves the studying and testing of patients' hearts and in some circumstances including the treatment of the pathology. It's a specialist field that quantifies and treats heart disease. When we talk about quantification, quite often we use the terminology mild, moderate and severe. Cardiac physiology can be divided into two main areas. They are non-invasive cardiology, where we are performing blood pressures, ECGs and transthoracic echocardiograms, which you can see on this image. And in the invasive world is where we work as part of a multidisciplinary team and deliver things such as cath lab based procedures as well as cardiac rhythm management, which is pacemakers and defibrillators. Here in Southampton, we're very fortunate. We have our own dedicated teaching facilities. We have a dedicated classroom where we deliver all the theoretical knowledge regarding cardiac anatomy and physiology and diagnostic testing of the heart. And we also have our own dedicated skills lab where we put those skills into practice in a safe learning environment. And here on the image here, you can see Anthea, one of our students, and she's performing a transthoracic echocardiogram on a patient. So we use the skills lab to prepare you for placements, and we set up the skills lab and run it as it's a real department. So the students are in uniform, hair up, no jewellery, and whatever PPE is in place at the time, they will be wearing to prepare for clinical placements. Placements are integral to the programme and they are 10 weeks, 15 weeks and 25 weeks across each year, and each year the placement gets slightly longer and slightly more complex in the level of cardiology and testing and treatment that we perform on patients. Now, the way the course is structured, that leads nicely into the year 3 placement being 25 weeks long, and that tends to lead into our students gaining employment within a cardiac department. We're very, very fortunate regarding our graduates are snapped up before they finish the programme. For students applying to the programme, well, we'd like you to come knowing a little bit more about cardiac physiology, how you discovered cardiac physiology, and also include any transferable skills that you've learned through part-time work, volunteering work, in groups, independently. And what I would say is be aware of what's involved with the programme. For the interviews, be smart, be on time, and come with some questions. We like it when you ask questions. And what about the career at the end of the programme? Well, there is a national shortage of cardiac physiologists, and our students are sought after by cardiac departments around the country. They all are employed before they finish the programme, and because again the way that the programme is structured, the transition from being a student into a first qualified post is almost seamless. You're already doing the job by the time you finish the programme. And of course, because our course is accredited by the National School of Healthcare Science, it means our graduates can register with the Academy of Healthcare Science, which they will require to apply for an NHS job. And of course, because it's cardiac, everything we do makes a difference to people's lives on a daily basis. If you want to find out more, then there's the website that you can go to. But of course, you can go to the university website to find out more about the programme. And of course, there's always open days that we have every year in the June, September and October time. And you'd be more than welcome to come along and say hello and find out more about this amazing career. Thank you for your time, and we look forward to receiving applicants from your students.